This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. Dave Wilson with you. Our guest this morning is John Huber, MSN FMPBC Primary Care, and he joins us on the program today. We'll get into the topic. I'll tell you about that in just a moment. John, good morning. Thanks for joining us.
Good morning. How are you?
I'm doing well. We'll get into summer safety, and that brings back some memories from childhood, thinking about summertime and visits to urgent care and the ER and stitches, et cetera, et cetera, et cetera. But we'll jump into that in just a moment. But first, let's talk about you for just a second. Tell us, John, a little bit about your background, education, where you come from, how you ended up in Morgantown, all the above.
Well, I moved from Columbia, Maryland in 2000 to the Morgantown area. I went to WVU and got a Regents degree, and then decided that I wanted to become a nurse. So I went back to WVU. I got my bachelor's in nursing and then got my master's in nursing and became a nurse practitioner. So currently I live in Smithfield, Pennsylvania. I have a little farm there, and obviously I work for a primary care for Mon Health.
Well, we're glad to have you on the program. So, you know what? That's actually a pretty good segue. You know, when you're out working on the farm a little bit, whether, it's dealing with any animals, working the garden, maybe putting up hay, you get out there, you get in the summer, and you've got to just take some precautions because it's hot, it's humid, and that sun can be beating down on you. So just generally speaking, as the temperatures, and we've seen them, up in the upper 90s this month, it's been hot and dry. Just what are some things in general you need to think about when you're going to be out there, whether it's working out in the summer heat or playing ball or just spending time outdoors right now?
So one of the first things is use sunscreen. You should use an SPF of at least 30 to avoid that long-term damage to your skin, not just the sunburn that you get that hurts, but long-term skin damage. The biggest thing, I think, is hydration, however, and that's not just drinking water. We think of hydration as just drinking water and lots of water, but when you're out in this heat with this humidity, you're sweating, and with that sweat, you lose sodium, you lose potassium, you lose a lot of electrolytes. And so there are many preparations that you can get in the store that have electrolytes with them that are good to add when you're working out in that heat or enjoying a picnic out in that heat, something to provide you with some more electrolytes.
And it's not just when you're out in the heat that you need to be drinking and replenishing electrolytes, like you say. If you spend enough time around sports, they will tell you need to be hydrating in the evening before you're out working as well. So it's not just something you got to do. You got to be thinking about while you're outside.
Exactly. And the average male should drink about 2 quarts of water a day. That drops a little bit for a female, but that's a lot when you think about the amount of liquid that you should take in a day to become hydrated and stay hydrated.
Well, we don't have to get into it, John, but there's an easy way to tell if you're staying hydrated, right?
That's exactly. Okay. As clear as it is. That's what you want.
There you go. We're talking to John Huber this morning, primary care with Mon Health. And one of the other things I was just thinking about when you're talking about sunscreen, nowadays, you think you're outside, it's hot and it's humid. You don't want to have the long sleeve shirts on, but some of the sportswear, the long sleeve shirts are actually pretty cool, both figuratively and literally, John. So that is also something to probably keep in mind if you're going to be out in the heat. It is possible to stay cool and keep covered up a little bit.
That's exactly right. And a lot of that stuff has the UV protection that you need besides keeping you cool. They make them in long sleeve, short sleeve, all kinds of stuff in order to protect you from that sun and keep you cool.
What do you talk about with your patients when they come in for a well visit about summertime protection and tips and things to just keep in mind, in addition to like the sunscreen and being aware of the sun?
Well, another thing that happens in the summertime is there are a lot of allergens out there. For example, today the grass pollen count in Morgantown is high, and a lot of people don't pay attention to the fact that they have seasonal allergies. I'll ask a patient if they have allergies, and they're like, well, no, I don't think I do. But just by exam, it looks like they have allergies. So we advise them to take something over the counter. One of the generics is fine as far as an antihistamine that will help with allergies. So that's a big thing that people have that they're not really aware that they have that could cause them some discomfort during the summertime.
I can testify to that, John. Before the end of the show, I will have fought off probably a half dozen sneezes just to get through this half hour. And that's that dry, that pollen count being high in the air. I can testify to that, I guess, is just my point there, John. I hear what you're saying.
Yeah, that's exactly right. I was out working on the farm yesterday, and I'm a little congested today, still taking all the medications that I tell patients to take. But it's because the pollen count's so high right now.
What are some things to consider that maybe aren't common or, glaringly obvious when it comes to summertime safety?
Well, another thing to consider is the food that you're consuming when you are having food outside for picnics, get-togethers, even if you are just carrying a lunch with you to go somewhere. Food safety is important. Any food that is perishable that sits out of a cool temperature for more than 2 hours is not really safe to eat. And believe it or not, we do end up seeing a fair amount of foodborne illnesses, most likely because people didn't really take precaution with their perishable foods.
I'm sorry, I was starting to chuckle just a little bit, John, because I was thinking about, and I bet a lot of people can relate to this, the family reunion or the covered dish dinner where the potato salad is sat out on the table all afternoon long. And you're thinking to yourself, is it good or is it not? The answer is it's not, right?
That's exactly right. That's a good way to get some salmonella.
Talking to John Huber this morning, primary care with Mon Health. We're talking about summer safety tips. Going to take a break, and when we come back, I was thinking about, as we started the show, my childhood, and it inevitably in the summertime ended up in the ER. There was always some sort of accident happening at my house. We'll talk about how maybe we can prevent some of those accidents coming up on the other side of the break. You're listening to Mon Health Talk this morning on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
John Huber is our guest. We're talking primary care and summer safety tips this morning on the show. And John, many of us as kids probably remember summertime also meant at least one trip to the ER, stitches, broken bones, etc. Now, we may have been lucky enough to pass on those genes, and now we're taking our kids to the ER with stitches and broken bones. It's summertime. Things happen, but can you prevent some of those accidents?
Certainly can. One of the accidents that we see a lot in our walk-in clinic or in the ER are from mowing accidents where people are either hand mowing or riding on a lawnmower. So with those, you should always wear closed shoes, not flip-flops, preferably a steel-toed shoe. That would help prevent injury potentially. Also, kids shouldn't be riding on the lawnmower with you, even though it seems like a fun thing to do. Kids fall off these lawnmowers and get seriously injured sometimes. So those two things are probably, the most important, besides when you're out there weed eating doing your lawn, wearing eye protection. We get people in here on a regular basis that have something in their eye because they were out weed eating without eye protection, and got something in their eye. So those are ways that you can prevent those things.
We talk about those accidents happening, and sometimes things do happen, and, well, you got to go get checked out. Do you offer walk-in care? Are there clinics available or at the primary care office? Can I just walk in and go, hey, I did not listen to John on Mon Health Talk, and I was not wearing my safety glasses when I was weed eating. Do you have walk-in care available?
Certainly do. We have it in a lot of clinics. You can go to monhealth.com/primary care and see a list of the clinics that have walk-ins available. Our clinic, the Cheat Lake Clinic that I work at, we have walk-ins constantly. We have 2 walk-in providers here for things such as this.
You mentioned the lawnmower injuries. What are some of the other common accidents or accident injuries or accident ailments that you tend to see, especially in summertime?
We also see some burns, people lighting campfires, people lighting fireworks. We get a fair amount of minor burns here. Any of the other burns end up in the emergency department. But, fire safety is important as well. Lighting off fireworks, make sure it would be a good idea to have protection from your hand if you're using fireworks. Wear a glove or something like that. Kids should not be around fireworks by themselves. You should always have adult supervision when that happens.
John, it sounds like you just need to use a little bit of common sense here in the summertime. That's probably good advice all the time, but especially in the summertime.
That's exactly right. If common sense was used by everybody, we wouldn't have a big walk-in clinic here. We'd have some people that have some ailments where they're sick. But common sense, yes, definitely is lacking, and that's why we have some of these injuries.
Got to take another break. We're talking to John Huber this morning, Primary Care, talking about summer safety. This is Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a couple of minutes left with John Huber this morning. We've been talking summer safety. John is with Primary Care with Mon Health. And John, always worth mentioning the importance of primary care, and why should we have a primary care physician? Why should we get those regular wellness checkups and wellness visits in?
Well, screenings is one thing. By screening folks for things like breast cancer and like colorectal cancer, we can find things in early stages when they can be treated very early and then have much better success. The other thing is things like hypertension. That's called the silent killer because it does not have symptoms for a lot of people. And we'll find patients who are hypertensive who have no signs or symptoms, and we can treat them. Same thing goes with cholesterol. You can't tell your cholesterol is elevated unless you do some blood work to figure that out. So by seeing a primary care regularly, we can do those screenings. We can check your blood work, make sure everything is within normal. And if not, then we can come up with a game plan to treat it.
When you go in for the wellness visit, should you as a patient, should you bring things up that might be of concern to you, or if something doesn't feel right or this hurts a little bit, should you bring those things up at that type of visit?
Without a doubt, and that's what it's for. So you should always write this down and bring a list with you, because by the time you get in here and start talking to us, then you forget things. So it's always good to have a list and go over things that often people won't bring up, and we will ask questions that will get that information from the patient. But, for example, things like anxiety or depression, there's a lot of that, and that is something that in primary care we do treat. You don't have to go see a psychiatrist for things like that. Also, people are concerned about their weight. There are a lot of different weight loss programs and things that we can discuss with them. But it's always good to write down a list and then bring that with you.
And as they I don't know if it's a cliche or not, John, but there's an old saying: the three people you should never lie to is your preacher, your lawyer, and your doctor. So if there is something bothering you, it can. That's the time to bring it up. It can be treated, or at least a game plan
exactly
developed, right?
Yep, that's exactly right. So if you can't tell us, who are you going to be able to tell? And again, everything that happens in the office is confidential, so we can treat those issues where people really don't want to come and tell you that they're having depression issues, but we can treat those, and that all remains confidential.
Do you ever get the conversation? Does it ever start like this, John? You're going to think I'm crazy, but do you ever hear that kind of conversation as the patient person kind of goes into what's concerning them, or the answer is you don't think they're crazy, right?
Right. There are a lot of people who will say that, hey, you're going to think I'm crazy, but I have this, this, and this going on. Well, we're trained to try and figure out if those things belong together and if they are indeed a sign or symptom of something more serious. There are several different disease processes that a person could say that they have all these signs and symptoms, but they don't really make any sense. But to us, they do. And then it's something that we can treat and that we can help the patient with.
All right, John, where can folks go to get more information about primary care, maybe schedule an appointment?
So they can go to monhealth.com/primary care. There are places on there you can find a primary care provider, and you can even schedule an appointment.
And don't hesitate if you don't have the primary care physician. I know there are a lot of folks out there. I can raise my hand here, John. Might be a long time in between appointments, but there's no better time than the present.
Exactly.
John Huber, our guest this morning. Hey, John, I appreciate you taking a few minutes, and enjoy the rest of your summer. You stay safe as well out there, buddy.
Have a great day.
You as well.